they do have back pain, our big question is, have you seen a medical professional first? If you haven't and it is quite severe, then we will refer them to one of our medical professionals. We have a great chiropractor who specializes in working with people with herniated discs. You'll be hearing about him tomorrow. And we will refer them to someone who's professional who may know how to handle that. And then from that point on, once they've been diagnosed and possibly treated, depending on what their needs are, then we will design a medically prescriptive exercise program that actually deals with helping them to reduce their pain and then strengthen their core muscles and everything else that's related to that back pain so that they actually feel better, function better normally in their day-to-day living.
Joanne, is age an important factor about back pain?
Absolutely. You know, between the ages of 30 to 60 years of age, a lot of people will experience lumbar disc hernias, muscle strain, or other kinds of soft tissue strains. Now, you know, we're very active when we're young, and so we do crazy things or we overwork in a gym. So we'll end up having some sort of low muscular pain. That's normal and it goes away. But when you have like lumbar disc hernia pain, that's when it becomes a little more serious. Now, after the age of 60, we experience joint degeneration. We'll have things like spinal stenosis, osteoarthritis, compression fractures. Compression fractures is from osteoporosis. Those are more serious and, again, have to be addressed specifically, and all of them come with their own different levels of pain. You can have mild to severely debilitating pain with all of these different problems.
Well, how does one know how serious their back pain is? I mean, you had to have a muscle tension. I used to get years ago, a spasm, a muscle spasm, and massage, but there are ways of bending. There are ways of doing things that will enhance your back and not detract from it. Absolutely.
You asked how does someone know whether they have a serious back issue. Well, if you find that this back pain has gone beyond, 4 to 6 weeks, you need to get that checked out. There may be a real serious issue. If you find that you cannot move, it's very debilitating, you need to get that checked out. There are a number of back problems. If you're diagnosed with vertebral fractures or spinal stenosis, scoliosis, spondylolisthesis, and in some cases they're unknown, they can't even predict or can't even determine what the back issue is. These are things that are going to cause pain, and so you'll know. And then there's things that you can do to actually, once they've been diagnosed and you've spoken to specialists, then there are things that you can do to reduce that back pain and get back to some normal level of functioning.
Okay, so tomorrow we're going to be talking to Dr. Tony Van Hoof, who's a chiropractor, and he's going to continue on talking about back pain.
Yeah, one of the most serious back pains is herniated discs that people are experiencing. A lot of people experience that, so he's going to give you some great information on that.
All right, well, that's great, and we're looking forward to that. And then we'll continue talking to you as soon as you're back, and we look forward to speaking to you about many other issues in the future. Thank you, Joe, and have a great Thanksgiving.
You too.
Take
Bye-bye.
care. Joanne James, founder and medical exercise specialist of Medfit Rehab, will improve your overall health through medical exercise. Contact Joanne James, 647-259-5481, Columbus Center Athletic Department, Dufferin and Lawrence, medfitrehab.com.